Well, welcome back, YouTubers. I was going to say it's one of these videos where I'm talking about modding my truck and drinking a big adult beverage and going making rips out in the street. But unfortunately, it's not one of those videos. My dog right here, Molly, basically she hurt her knee. She started limping real bad about a week ago. She's getting a little better. We took her to the vet. But unfortunately, we found out she has a couple of problems. So she has bad hips and she has a torn ACL. So unfortunately, all the upgrades on my S10 are gonna come to a halt for a while. And the reason why is because I'd rather spend money on my dog than spend money on car parts. But don't worry, we're still gonna do 85 stuff because the carburetor and that's already purchased. But as far as like more shocks, and I was planning on doing a turbo or a supercharger to the S10, that's not gonna happen. That money is definitely gonna go to my dog because in my opinion, a family pet is more important than car parts. So tomorrow, we're gonna go see the vet and we're gonna see exactly how bad it is. So all proceeds from the channel are gonna be going to this girl right here. So you guys make sure that you like and subscribe to your friends because all that money is gonna have to go to her. You know, as much as I would like to empty my bank account, I really can't do that because the wife, we got a house and all that stuff, and we need a little bit of money in case we have emergencies. But we got a little bit of money stored away, and we only spend so much on Molly. But unfortunately, I think the extent to her issues is gonna be more than we can really afford. So, if you guys can tell your friends to subscribe, then we are going to make it happen and try to give this dog right here a better life because she is super sweet. So now, let's fast forward to tomorrow. We're gonna see the vet. Hopefully, he's gonna want to be on camera too. Say what's up, Molly. Kisses? I'm gonna get this good girl. I guess first let's go ahead and tell the viewers like who you are and your practice here.
So we are a small animal hospital in Chantilly. I'm Dr. Ahluwalia, usually called Dr. A. We do all kinds of things here. We have wellness plans, but most common surgery we are doing here is orthopedics and the TPLO surgery, for which Molly is here too. And these are her x-rays. So we're going to talk about her knee and her hips. So let's look at her good leg first. So this is the right leg, which is the good leg of Molly. This is the femur. This is the shin bone. And in here is our ACL, or in their case it's called the CCL. But we can't see it in the x-rays, but we can see the effect of it being damaged if it is damaged. It inserts somewhere from this point to this point. And all this black structure here is the joint fluid, and we want that. This is good. So it tells me that this joint is in normal shape. To the other knee, what you see here is that black structure is a little bit less, and you see this gray structure, which is like a fat, which has displaced because of the inflammation. And if you look carefully, this is where the cruciate ligament goes, and you can see a little bit damage there too, as if something has been ripped off from that part or those angles. And what you also see is this is her kneecap. You see a little bit of her arthritis here, a little bit of arthritis here. These are the compensatory mechanisms because they're trying to make up for the lack of CCL with other structures. Okay. We're going to find this angle for Molly, and we're going to see, so she is approximately at 25 degrees. So her femur is sitting on the tibia at a 25 degrees angle, and what's main structure holding it is not there. So what we're going to do is we're going to make a circular cut somewhere here along these green lines. We will do a better calculations on day of surgery, and now we have a fracture, and we're going to move the top piece minus 20 degrees so that effectively we have a 5-degree slope. Gotcha. So that way we change the biomechanics of the joint and we make the CCL irrelevant. But her other concerns are the hips.
Yeah, that's the biggest.
Right?
Yeah.
So if you see their hips are a ball and socket joint, and you see this ball just out there and literally no socket, and it's on both sides, but right side is worse.
Just the worst one.
And
yeah.
probably that's why her left CCL has gone, because she has compensated the right leg with the left. She needs to be evaluated for a hip replacement, because that gives the best outcome, best morbidity, like no morbidity, like range of motion is good. But the people, the surgeons who do the total hip replacement, they can tell better if she's a good candidate, what is required, what all is needed. Both hips are needed at the same time or one after the other.
I guess explain that the FHO, there's two procedures, there's a hip replacement and FHO, correct?
Right. So FHO is more of a salvage procedures, which we do, but if hip replacement can be done, that's the gold standard. So what is done in FHO, the easiest way to explain it is think about your arm. How is it attached to your body? So your shoulder blade is attached to your back just with the muscles. That's around it rotates. So the goal is to make something like that, like have the muscles support that structure too.
Yeah.
So what we do here is we make a cut and we remove this little head. So the part of the pain which is coming is because bone on the bone and it's not sitting properly. So the goal of the FHO is to just remove this structure, and the leg will be literally hanging in there. You will, in the X-ray it will look like, but the muscles, the group of the muscles which are around the femur will make a scar tissue, a fibrous tissue, and that will hold it in place and will give good range of motion. Definitely nothing compared to a natural hip or a hip replacement, but that constant grinding of bone on the bone will go away, and they will be painful. Lighter and smaller the dog, better candidates there.
Yeah, so basically eventually she's gonna have to have some procedure done when she gets older. Or
Right.
so if we were to do an FHO, is it better to do it sooner than later when the dog's younger, or is it better to do it, just wait until see how she starts acting?
Probably better sooner, because we want that muscle support. Because if they stop using the back legs and the muscles kind of atrophy because they're not using it, then it becomes harder. It's true for hip replacement too. You want to do them sooner than later.
Gotcha. But we can't do it because her knee's blown out, which is not good.
Yeah, if both are bad, then knee trumps the hip. So we first, we first fix the knee and we go from there.
Okay, so for this next part, I didn't tell you guys, I should have told you guys before, but they had to sedate Molly to do what's called a drawer test on her knee. So the dog has to be completely limp, and of course if you're grabbing a dog's limb and they're injured, they're gonna tense up their muscles, so you can't really tell if it's loose or not. So they have to sedate the dog. You'll see when she comes back out, she is pretty darn drunk. And when they do a drawer test, so they see if that knee moves back and forth from the other joint, it's supposed to be stable and not have all that movement. It has movement, then of course the CCL or ACL on us is torn. Kind of the same way they do a human test. Now, this is my other dog right here. You see her? She wants this ball. This is my whippersnapper Ginger right here. Ready, baby? He outran the ball. But also I'm making a GoFundMe for Molly because the price for hip replacement is, look at your ball, baby, is way out of our budget. So if she's gonna get hip replacement, I can't do it without help from you guys. So I have a GoFundMe, so you look in the description. I'll even make a link to it. I'll try to make a link to it, and you can kind of click on it on the video, but if you go to the description, and I'll put it in the comments, there's a link to donate. You don't have to donate much, just anything helps get her back to where she is. But it's about $7,000, $8,000 a hip. So that's about $16,000, which it ain't happening. We don't have that money. So I can't do without you guys. Share these videos, and hopefully Molly can have a happy ending. So here she is coming back out when she's just waking up from being sedated. Hey baby, okay? Oh baby girl. Hey sweetie. You a little drunk? You a little drunk, baby? Oh, it's okay, baby. Oh, I know. It's okay. We'll get you fixed up.